Good morning. Welcome to the Psychological Resiliency Workshop. My name is Ellie Maureen Newcomb, and I'm a fourth-year medical student at the University of Minnesota and a 2020 Emerging Leader. We are at a unique and grave juncture in history with the convergence of economic collapse, the global pandemic, the civil rights movement, political polarization, and the sixth mass extinction. Our panel examines evidence for nature as a tool to enhance psychological resilience in the face of these global events, as well as the barriers to implementing nature as a mental health intervention. I am joined by Dr. Minus Cleveland, Everly Jazzy, and Peter James, who will introduce themselves and their work.
Thanks, Ellie. I'm Minus Cleveland, Medical Director of Employee Health at Legacy Health in Portland, Oregon. We're a regional health system with 7 hospitals, 14,000 employees, 3,500 medical staff, and 2,500 volunteers. Though I stopped seeing patients in the ER 3 years ago, I've been very involved and remain involved in Legacy's response to the COVID-19 pandemic. I really appreciate this opportunity to be with you this morning, and it's an honor to represent Legacy as a 2020 shift winner. Stress and burnout among nurses, doctors, other healthcare professions, huge issues. And this was before COVID. But the crucible of COVID has really upped the ante. Our staff now face daunting challenges, taking care of really sick patients, fear of catching COVID, fear of spreading COVID to family or friends, being in a situation that's not like any other in terms of taking care of patients. Sleep problems, fatigue. A colleague the other day described what it was like taking care of a very sick patient, a dying patient, and their family couldn't visit. They could only talk with the family on the phone because of visitor restrictions. 40 years in medicine, I've never seen anything like this. So now it's essential, it's critical that we do all that we can to prevent and mitigate stress, build resilience, and promote good health among our staff. I can never remember mission statements of an organization, but I can remember legacies. It's short, and I believe in it. Our legacy is good health for our people, our patients, our communities, and our world. When I first heard this years ago, when I was still working in the ER, I thought, as a clinician, patients should always be at the top of the list. But now I know that the word order is right. To provide the very best care for our patients, we must first take care of ourselves and each other. I chair a system-wide group called the Good Health Council that is mission-based and helps set the agenda for wellness activities at Legacy. We now have 9 good health teams throughout our system that do a variety of events and campaigns to promote health through healthy eating, active living, and a peaceful mind. We also have had a robust therapeutic garden program at Legacy for many years, due in large measure to the pioneering work of Teresa Hazen, horticultural therapist and our program coordinator. Vision, passion, persistence, relationship building. Teresa has led many multidisciplinary teams to promote the value of nature contact, develop hospital gardens, and do research. We now have 12 hospital gardens at Legacy, the most of any medical center in the country, maybe the world. I look forward to sharing specifics about the landmark Legacy Nurse Study and how these once separate streams of good health and therapeutic garden program have merged into a river that keeps flowing. Thank you.
Thank you. Everly?
Yeah, sorry, the fire alarm of my house is going off, so I'll go after Peter.
All right.
Okay, so I'm Peter James. I'm an assistant professor at Harvard Medical School and at the Harvard T.H. Chan School of Public Health. I'm trained as an environmental epidemiologist, and when I started this work, most of environmental epidemiology was focused on air pollution, other kind of chemical factors and how they influence health. But I've been really lucky to start my career at this time where we're able to examine other factors such as nature and how time spent in nature may be related to health outcomes. I usually work with large prospective cohort studies like the Nurses' Health Study. These are studies of decades. We've been following hundreds of thousands of people looking at their health outcomes. And we've been really fortunate to look at nature and how nature influences mortality, depression risk. We're looking at cancer and cardiovascular disease. And I've seen my field of epidemiology shift, no pun intended there, but thinking more about nature, the built environment, how our kind of surroundings and social determinants of health influence health. And really, really excited to talk more about psychological resiliency and how this is even more important in a time of COVID and a global pandemic. So thanks for having me.
Hi, and I'm Everly Jazzy. I'm a graduate student studying environmental social science at Ohio State University. And I do research on how spending time in nature has differential effects for various socio-demographic groups and groups that have varied familiarity with nature in when they spend time in green space. So I run experimental studies with students currently walking in neighborhoods of their choice because of coronavirus. It used to be that I had an experiment and control group. And yeah, I'm just really interested in how spending time in nature can affect health disparities and how we can address various mental health disparities through spending time in nature for vulnerable groups. Before coming to Ohio State, I was an outdoor preschool teacher at Tiny Trees Preschool in Seattle. I was a National Park Service ranger in Gates of the Arctic and Katmai National Parks and an interpreter at Grand Teton and Coulter Bay and Yosemite. And I did my undergrad at George Washington University, where our first speaker talked from. And that's everything, I think.
So today we will hear from each of our panelists about their work. After, we'll break into smaller group sessions before coming together to conclude today's session. Because our conversation is virtual, please use the raised hand function and chat bar to contribute and ask questions. With that, we will begin our panel discussion. So Peter, what is the big picture overview of nature and health research for the field of epidemiologic research?
Yeah, so great question. I think a lot of you here have probably heard of the term biophilia. The Harvard biologist E.O. Wilson popularized this term. It's a theory that we of human beings have evolved with nature to have an affinity for nature. And building on that concept, there is a lot of empirical evidence suggesting that time spent in nature or even viewing nature allows us to restore our attention and decrease our stress. Green spaces may also buffer our exposure to air pollution, noise, and extreme temperatures, serve as a setting for physical activity, and provide a location to engage socially with our friends and neighbors. So all those kind of pathways, those mechanisms are ways in which spending time in nature may either directly influence our health or indirectly through buffering our exposure to harmful factors. And randomized trials, the kind of gold standard of evidence, have shown that spending time in nature is associated with lower stress biomarkers, lower blood pressure, improved mood, decreased anxiety, better cognitive function. So a lot of short-term studies where we do see that just randomizing someone to walk in nature, as Everly was speaking about, you do see this immediate effect. And then thinking about longer-term kind of chronic health outcomes. The work I do is usually observational studies where we look at people over decades. And studies that we have done and studies that others have done have shown that people who live in greener areas have lower incidence of depression, anxiety, and other negative psychological factors. And related to other hard health outcomes, lower risk of adverse pregnancy outcomes, better cognitive function, better immune function, improved sleep, lower rates of diabetes, cancer, and cardiovascular disease. And actually, I think one of the stronger findings is lower mortality rates. And this is accounting for lots of different socioeconomic factors that might kind of explain these differences, right? So I think the evidence is growing, especially in terms of psychological outcomes. The focus of this panel, I think we have both short-term and long-term studies that support the idea that having access to nature, spending time in nature, is associated with improved health.
Thank you. And Dr. Cleveland, what did you learn from your research of gardens, and how did you take evidence and translate it into policy and programs?
Thanks, Ellie. Peter, thank you for that great overview of the current state of sort of nature and health research. The outpouring of this new research suggests that these findings are catching up with what philosophers and writers and theologians have been saying for a long time, that being in nature is really good for us. We are part of nature. Hippocrates said, "Honor the healing power of nature." Through Teresa Hazen's work, we were able at Legacy to connect with Dr. Ulrich, Dr. Roger Ulrich, a pioneer researcher. You may be familiar with his truly pioneering study in 1984 called "View from a Window May Influence Recovery from Surgery," where he found that post-operative gallbladder patients were in either a room that looked out on a brick wall or a nice patch of deciduous trees. And guess what? Those who looked out at nature did much better, fewer complications, less pain medication, out of the hospital earlier. So that kind of got things going, and we were very fortunate to be able to engage him as an investigator for our project at Legacy. This multidisciplinary team wanted to focus on using a hospital garden as an intervention. Legacy Emmanuel is our flagship hospital. It's our biggest hospital. It's a level 1 trauma center. And the second floor terrace garden was specifically designed to answer a very important question. When it comes to stress and burnout among nurses in high acuity settings, which is better, taking a regular work break indoors in a well-appointed break room, or taking a break outdoors in the hospital garden? Very important question. Before I share the results with you, I just want to say this got started before I was really involved in these efforts. I'm not one of the researchers. The good thing is that I can therefore I can therefore champion this research because I'm not on the papers. Well, the results was clear. Taking a daily work break in the garden was much better than taking it in an indoor break room. If a nurse, and these were nurses from high acuity areas taking care of some of the sickest patients at Legacy, if they spent 20 minutes in the garden, they had decreased stress scores, decreased burnout scores, and decreased fatigue, and interestingly, decreased anger. So what have we done with that? This reinforced, one, our policy about people taking breaks at work. Sometimes clinicians get so busy taking care of patients that they either forget or they're just pressured that they feel they can't take breaks. It's the law, but more importantly, it's for people's good health. So it really enforced the importance of taking breaks. And we made that a priority for our good health efforts, is to get people take their breaks and whenever possible outside in the garden. We also made our gardens and contact with nature the heart of our wellness and good health efforts. So in 2019, pre-COVID, our teams put together over 90 events, drew over 3,000 people, simple events, music in the garden, therapy dogs in the garden. We even do midnight in the Garden of Good Health. So we have a garden related event for our night shift employees, and who really appreciate it. So we have, I think, done a good job of translating this important research into practical benefits and activities for our staff. As far as we know, it's the only intervention study in the literature that uses a hospital garden to reduce stress and burnout. And Teresa Hazen tells me it's pretty unique to couple both a garden program with a full-on wellness, good health program. Thanks.
Thank you, Dr. Cleveland. As someone who's entering the medical profession, it is incredibly heartening to hear this expansion of wellness and resilience through green space in areas that are traditionally focused on really the medical side of healing. So that's really incredible. Thank you. And Peter, you have done research on socioeconomic status and nature contact. Have trends improved in recent decades? Why or why not?
So we have looked at the racial and socioeconomic composition of census tracts. So these kind of smaller areas of the US, looking at census tracts across all urban areas in the US. And we've looked at how neighborhood racial and socioeconomic composition predicts access to green space. We use satellite-based data on green space. We also look prospectively to see how changes might occur in green space. So how your racial composition of a census tract may predict whether you have increased or decreased access to green space. We found that actually neighborhoods with more American Indian, Asian, Black, and Hispanic residents cross-sectionally had lower access to green space compared to neighborhoods with more white residents. And then looking at changes over a decade, we actually found that neighborhoods with more American Indian, Asian, Black, and Hispanic residents had no change in green space access over time, or even decreases actually, while neighborhoods with higher percentages of white residents got greener over a decade. So basically these trends indicate that we are increasing our disparity in access to green space over time. And you asked the question of why. I mean, I think there's a lot of reasons why, and I think Dr. Fitzpatrick spoke about this in her keynote, that these disparities, we have not invested in green spaces in non-white neighborhoods really. And so the decisions that we make as a society on what we invest in, I think are what is driving these disparities. I think we'll speak about this a little later, but we have massive health inequalities in our country, and certainly green space access to nature doesn't predict all of these disparities, but it is certainly contributing. I think we'll talk a little bit about this idea of this ecogenic effect of nature being more beneficial to lower income and minority race populations. So we actually may use nature as a way of decreasing health inequities if we use it properly. But I think we have not, as a society, made those investments.
Yeah, it sounds like we have our work cut out for us. And it is, it's hopeful to see that we know what the trends are so that, we can really step up and address them together. Everly, you have started research on differences in benefits for various groups. What frameworks and bases are you using to explore this, and where is your research headed?
Yeah, so a lot of the bases for my research are in line with what Peter just mentioned. So there's differential use and access to natural spaces for various groups in America. We know that outdoor recreationalists are mainly like 74% white, 66% had an income greater than 50,000, 63% had at least some college. So that really doesn't represent the US population as a whole, like from the Census Bureau data. So there are so many barriers and constraints that even the stigmas and traumas that we don't think about in research that Dr. Fitzpatrick illuminated, and hopefully more researchers are tending to, because there is such a need for engagement for underrepresented minority populations in green space. And again, this links to health disparities. So a lot of the same populations face disparities in both access to green space and health. So if green space is tied to disease prevalence and it can lead to positive health outcomes in various physical and mental health realms, then it's something that can address health disparities. And that's what the Mitchell and Popham paper in 2008, and then Mitchell's subsequent work talks about with the theory of equigenesis, which is just that green space can have a quality of addressing health disparities, because low income populations in the UK had a higher well-being benefit proportional to their disadvantage once finally accessing and using green space. And building off of this, Moss et al. In 2009 found that residents who lived in a 1 kilometer radius to 10% green space were the same residents had increased prevalence of common diseases, and they had higher prevalence rates and did not live as long as those with 90% green space in their 1 kilometer radius. So there's such a strong link here, and my research is attempting to empirically test these differences because so far in the 40 years that nature and health has been studied, a lot of the initial work has been done, and now we need to parse out like who is this helping the most and how can we help change our healthcare system because of green space, through green space.
Yeah, absolutely. And I think, expanding on that, our next question segues beautifully into that for Peter. How does nature provide benefits to these unique populations that have stressors and health inequities?
Yeah, so I think as Everly was saying, we do see consistently in the epidemiologic literature that lower income and minority race populations do seem to get a kind of bigger bang for the buck for health benefit from time spent in nature. I think there's a few reasons for this. As I discussed earlier, this idea of attention restoration, stress recovery. When you spend time in green space, it actually has a direct effect of restoring our attention and decreasing our stress, right? So if you're experiencing stress, it is a direct treatment for that stress. I also mentioned that green spaces may buffer our exposure to harmful environmental factors, air pollution, extreme temperatures, and provide a location for physical activity and social engagement. And so I think populations with lower levels of stressors, fewer health issues, they usually have many amenities for health, right? So better access to preventative health care, higher income that allows them to have healthier behaviors more easily. And so I think when you think about that, adding green space isn't going to help them much when they already have so many amenities, right? So it's actually these populations that have lower access to these health promoting factors may get a benefit from having access to a green space, which is often a public amenity, often something that anyone can access freely, and therefore that might have a big benefit. I also mentioned that wealthier communities may have easy access to transportation. They may be able to travel outside of their neighborhood, fly to Jackson Hole to enjoy nature, while lower income communities may not have that ability to leave their neighborhood readily. So, it may be that you are much more exposed to your immediate neighborhood if you have lower levels of income, and therefore your surroundings really matter, while your environment and your access is much greater in wealthier communities. So I think those are all the factors that are important. And I know we have more time here, so I want to expand on another concept. We haven't really talked about this in our panel discussions, so maybe I'm taking us off the rails, but we also need to think about this concept of green gentrification, right? So the idea that there's this ecogenic effect, if I go and I create green spaces in a lower income community, it sounds like a great idea, but we have to do that in a thoughtful way, where we're not actually going and tearing up a community, building an amazing amenity of green space that's attractive to an entire city, and the subsequent knock-on effect is that you increase property values, you start pricing people out of the community, and you may potentially have this gentrification that occurs. So we really need to think thoughtfully about this, and there's lots of leaders who are working in this area, who are thinking about, are there pocket parks? Are there other approaches? I think the idea of community-based participatory research, well, I'm a researcher, but maybe just working with communities, maybe it doesn't have to be research, to help them, figure out what amenities they do want. And, in light of Dr. Fitzpatrick's talk today, thinking about how they interact with nature and what features of their neighborhood they would like to change. And what does nature mean to them? I think we talk a lot about this in our work in Boston, that we have the Esplanade, this beautiful riverfront park, but anyone can walk there and use it, but who feels like they actually should be there, and who has access to that amenity. I think these are really, really important questions. And you know, I think yes, I think that there are potential benefits to nature for populations with stressors and health inequities, but how we kind of implement nature, how we use nature as an intervention, we have to be really thoughtful about.
Thank you, Peter. I definitely agree with that. There was a comment from last year's SHIFT conference talking about, you know, really recognizing the value of what you were talking about of, you know, to the communities that we are in, you know, and trying to sort of augment, you know, there's grass growing through the cracks in the sidewalk. Like, that is nature, and that has equal value and significance in our day-to-day lives, as does, you know, flying to Jackson Hole. And I think a lot of what we're talking about in terms of privilege and disparities and how that affects different communities can really benefit from, you know, a shift in thinking toward that.
And if I could take just a few more minutes, I think we're doing okay on time. But you know, I think that's part of what we really grapple with in our research is how to measure nature, right? Is vegetation all that matters? Is a mountain the same as a city park? You know, I think often when people are, you know, looking at the research in this field, they think it's all about parks. But it could be street trees, it could be, you know, grass in the median strip outside of your house. So I think there's a lot of complexity there, which makes it kind of exciting and interesting, but it also makes it difficult. And you know, thinking about how to operationalize our work to tell urban planners and landscape architects what to do is the really tricky question, right? So do we say plant trees? If we say plant trees, what species of tree? You know, what health outcome are we thinking about when we're thinking about what to tell, you know, a policymaker or a community stakeholder? It's these complex questions that we are still grappling with, and I think we're just really getting started. Although this research has been around, and I might not, you know, mention that philosophers have thought about this for years. Centuries, but we still really don't know what we mean by nature, right? That's the hard part. So anyway, I just wanted to put in a plug for that's something we really need to think about.
Yeah, absolutely. And it's hopeful too that, you know, SHIFT is a really incredible venue to bring the public planners together, to bring the researchers together, just to get everyone in the same room and at the same table and really talking about this.
For sure.
Yeah, and towards that, I feel like running like qualitative interviews or more methods like focus groups, including communities is important because a community might evolve their relationship with nature. Maybe at first they do find like just a urban park enough for them, but then soon after repeat exposure, they start to expect more from their green spaces and a higher quality. Also to the green gentrification comment, I did want to plug this article that I think is really useful in looking at that, which is by Jennifer Wolk from 2014 that talks about just city planners working with the community to make parks just green enough so it doesn't price them out, but also meets their needs, especially in terms of mental health.
Wow, that is super interesting. Thank you. And bringing the conversation from, you know, health and nature, sort of having a focus on the pandemic that's happening right now. Everly, what have you noticed with participants going on walks during this COVID-19 pandemic?
Yeah, so I just wanted to share some quotes and again, like qualitative data that I received from my experiment collection in the summer. I'm still collecting currently. There were too many people out today. I don't mind seeing others, but I dislike having to alter my course to account for them, supposedly because of coronavirus. There were a lot of people not wearing masks. A man's dog came up to me, so I smiled at him and complimented his dog. I then went my separate way. So that's just a small interaction that someone had, seemingly one of their only interactions with another human. A kid on his scooter maintained social distancing by moving his scooter and saying, "Excuse me." That was just a funny comment. Walking with a mask makes the experience a lot less relaxing than pre-pandemic. So there's a lot of things to think about with coronavirus in the outdoors. Some people have higher anxiety, some people have lower anxiety with going outside. I actually have numbers from the summer collection. So 40% of students had increased fears around spending time in natural areas due to coronavirus. 54% had seen restrictions or closures to natural spaces they used to frequent. Hardly anyone had their recreational activities stay the same. 51% of people decreased their participation in activities in natural spaces due to coronavirus, and 49% increased, which is good. I think that increase shows that maybe we need to harvest this time and use that energy to make a welcoming area that people can recreate, because the outdoors, and it's getting colder, but the outdoors is a place that people can go right now that is safe to interact with other people, or just non-human living things. And with my research, I found that first generation students just going on a walk, not thinking about the walk naturalness, which is something that I look at, just going outside was very beneficial for them, more than non-first generation students. So that's very promising in terms of the ecogenic effect.
Yeah, that is very interesting. And I think too, we have this, I think just from like a bike shop standpoint, like the bikes are sold out. It is a seller's market, people flocking to outside spaces. And also, I think of that, and I think of living in Minneapolis during the murder of George Floyd and sort of seeing the protests and people going to the streets and gathering in masses. It was really, there was a moment where it's like, is this going to sort of spark the next wave of the pandemic in our city? How will this impact hospitals? Because, the last thing you want in a pandemic is people coming together, but the first thing you want when there is social unrest and change is people coming together. And how do we balance these conflicting priorities? And I think it was interesting to see that anticipated spike didn't happen. And I think in part we were outside, and in part people were also very intentional about wearing masks to address the disparities in COVID affecting communities of color. And I am very interested to see how, what's happening right now in our society will translate into research and then into practice. And Peter, who has access to nature, and what is the health effect in the time of COVID?
Yeah, so I think we kind of spoke about this a little earlier in terms of who has access to nature and what, how socioeconomic and racial composition influence access to nature now and during a pandemic and always. I think it's really during a global pandemic. We're all focusing on social distancing and we're increasingly socially isolated. I think we are all more cognizant of our urban green spaces nearby, walking distance from our house, as a fundamental resource to kind of maintain our physical and social activity while decreasing our risk of infection, right? So the idea that we, living in Cambridge where I live, I can walk outside, get to the river, I can walk around my neighborhood and see trees and flowers and basically so much nature, even within a very short walk of my home. It truly helped me psychologically to deal with, being basically on lockdown for months. I could only imagine what it's like being in, a setting where there's more overcrowding of housing, where there's no access to green space, to go for a jog or go for a walk. I think, one thing we think about is that this pandemic is certainly an unprecedented situation for our lives, but actually history has shown, we have approaches to combat infectious disease. And one of those kind of tools is the use of urban parks as a resilience measure. So this kind of sanitation theory, the origins of public health really were the idea of putting up these urban parks. And Frederick Law Olmsted, who designed Boston's Emerald Necklace and Central Park in New York, he championed this concept of parks as lungs and espoused these two great natural agents of disinfection: sunshine and fall foliage, which I think is really, really nice that people were thinking about using urban parks for this reason, for exactly this reason. Green spaces, as I've maybe beaten you over the head with, they provide a setting for physical activity, social interaction, but they also provide us the ability to be outdoors in safe distance away from others. And being outdoors, natural ventilation dilutes the amount of virus in the air substantially and greatly reduces transmission risk for COVID. I think with the addition of a mask, I think this is a very, very low risk proposition. As Ellie was mentioning, during these protests, people are outside altogether. We worried that there might be spikes in transmission, but we didn't really see that. And it's probably because these not only were people taking steps to wear masks, but they were also outdoors. And I know that outdoors doesn't equal nature, but being outdoors, being with other people outdoors is really just not nearly as large a risk. And we need to communicate that policymakers need to communicate that to the public, but maybe we need to communicate that to policymakers so that they can make more effective decisions. So I know, like at the beginning of the pandemic, when we decided to close all parks because we were worried about people congregating in parks, that was probably not the right decision to make. I think giving people information, in Cambridge, we have signs up in all our parks. We're encouraging people, we're shutting down streets so that people can walk and bike. I think these are intelligent decisions, and people are, smart enough, if you give them the information, that they can be outside, be physically active, enjoy our, outdoor spaces in nature responsibly, and not increase the transmission of COVID. So it really, this idea of psychological resiliency is essential. Like, we really do need that to thrive. We can't just, be shut indoors all the time. And I realize I didn't even speak to this, but we have seen in our research where we looked at how different counties had higher or lower access to green space. And we showed that actually the incidence of COVID is lower in counties that have more green space. We also conducted what we call stratified analyses, looking at the racial and socioeconomic distribution. We found that actually areas where population density was highest, so dense urban areas, actually got the biggest benefit from having more green space. So this kind of speaks to what I was saying earlier, is if you do have potential overcrowding, it's so much more important to have this kind of setting to go to get away, where you can actually be outdoors and see friends, maybe get some physical activity, but not increase your transmission risk.
Yeah, absolutely. And I like what you were saying about sort of empowering people with the knowledge they need to make informed decisions during this time. I think that's a really prudent strategy to go about this pandemic, especially when there has been various information sort of floating about. And Dr. Cleveland, I'm bringing it back to the hospital and healthcare professional setting. How helpful is it to have physicians and other healthcare professionals championing nature contact? And how can we engage more healthcare professionals as nature champions?
It's critically important that we have champions from all members of the healthcare team and people in general to champion this important work and these opportunities to improve health through nature. It's great to have, there's a few of us physicians who are getting more and more involved in promoting this work, but at least within Legacy in our community, some of our best champions are physical therapists and occupational therapists who work with patients in our gardens, actually do therapy with patients in the garden. Nurses, really the heart of healthcare, are some of our best advocates, and I will share a quote from one of our nurses about the impact of gardens for her and her staff. In terms of other things we can do, we find in general that if people have had a great personal experience of being in one of our gardens or being outside in nature at work, then they're more likely to spread the word. They're more likely to come back to an event and champion these spaces. That's partly why we did over 90 events last year, just getting people out to experience the garden. We also do continuing medical education events. I'll just show a flyer from us continuing medical education event. We did 4 of these over the last 2 years called Mindfulness in Nature, Strategies to Prevent Clinical Burnout. We did that for legacy nurses and doctors and other staff and community members. We, in championing the data from our study, and studies, we also like to champion not just the data, but our multidisciplinary approach. And that's been one of the strengths that Teresa Hazen has provided great leadership on. I mean, Teresa, myself, and Bridget Martin, acute care nurse that I'm going to share a quote with you. We presented at the Healthcare Design Annual Meeting down in New Orleans last year, and now that's pretty multidisciplinary, doctor, nurse, and a therapeutic garden coordinator. So we think that's been part of our success. And we do local presentations. We reach out to the media. Just had a show on local TV, Garden Time, about using gardens and space, outdoor space, to deal with the pandemic. And let me share this quote with you from our nurse. We call her, and then I think there's time, I can close with a real brief story about sometimes personal contact in unexpected ways can help create a champion. So Bridget Martin is a nurse in our neurotrauma ICU that's right near the second floor garden at Emmanuel, and takes care of some of the sickest patients in Legacy. We call her One Take Bridget because anytime she gets interviewed for a film or news coverage, she just nails it. And here's what she said: "These are unprecedented times, especially for hospital workers. To have a garden to visit is essential to maintaining balance when all around me seems out of balance. A blooming shrub, the sun on my face, the smell of rosemary, and everything shifts towards the better. Breathing slows down, mind relaxes, and energy is renewed." One Take Bridget. Let me briefly share this story that, again, sometimes unexpected ways can help you out, and also kind of addresses a question, well, who might be immune from this stress and burnout? This involves a hospital garden, a sunny summer lunchtime last year, and possible fisticuffs. I was sitting in the hospital garden at Good Samaritan. I was finishing my little lunch. I was about to head back to my office, and suddenly a bike whizzed by me right through our garden. And I said, as nicely as I could, as they were going by, you know, we really appreciate if you walk your bike because we have patients who are doing therapy here. And as this person whizzed by, I will give you the PG version, they said, "Flip off." I said, you know, I'm getting older here, but I'm a scrappy point guard from Indiana. What did you say? So I went to make sure that, I figured, well, here's my assumption. They're somebody from the community and they're cutting through to get to the other street. So I followed them, find out what was going on. And in fact, they were turning to go into the hospital. So assumption wrong, number one, wrong, not a community member, but probably an employee. So I went over to follow up. I again tried to start the discussion about not riding bikes, and I got the same greeting, which I won't repeat, but it was pretty angry, and this was a pretty good sized person, and I was happy that I was still intact, but we couldn't let this stand. And the bottom line is that when we followed up, it wasn't somebody from the community. It wasn't somebody from an employee. It was one of our medical staff. So the next day I received an email that said, we understand that one of our staff in our department basically treated you badly. We want to meet with you so that this physician can apologize to you in person. That made me nervous, but I said, okay, we'll do it. So of course I suggested, well, let's meet in the garden. So we were going to meet in the garden. My third assumption was, well, this is a physician probably with a history of bad behavior, verbal abuse or something, probably not going to be a real nice person. Well, after meeting with this individual, it turned out that this was a really great person who loves gardens, who just, and being outdoors and actively gardens, but said, you know, sometime, and gave a heartfelt apology and said, you know, sometimes things just build up and I have to reset things. And I was wrong on my third assumption because he had never had any problems before, any kind of problems as a physician. And it turned out that then he went on to help us promote garden events, made suggestions about where we could place signage to remind people not to to ride their bike, and became a real supporter for us. And it turned out he was just a really good person who had a really bad day. Maybe some of you have had a really bad day. I know I have, and on those days I wasn't my usual affable self. So we are all at risk for stress and burnout. We're pleased at Legacy that we're doing the work we're doing to try and help mitigate that and to help promote good health. Thanks.
Thank you. What a story of resilience and coming together and moving forward. And it's really beautiful that, you know, the garden space could be a place of reconciliation with that.
Yes.
So thank you all for sharing your expertise. With that, we will begin a 10-minute break and we will regroup at 10 a.m. to begin our breakout sessions. Thank you. Hello, everyone. Welcome back to the big group. Thank you for sharing your thoughts and expertise during our small group discussions. And for the next 50 minutes, we have time to bring these chats to the bigger group. And then while we're talking, if people have questions, please drop them in the group chat and we will do our best to respond to them as we come up. So right now we're just going to ask the group leaders to be spokespeople for their team. And the first question that we have is, what did you hear in your groups and what are your main takeaways? And prior to doing that, I'd like to introduce, we had more people leading groups than the panelists. So if you led a group and have yet to introduce yourself, please do that now.
My name is Nick Otis. I'm a health research scientist across different subfields in psychology and nutrition. And here I study the mental health outcomes of environmental exercise psychology for people with depression, PTSD, or both. And I'm going to pass it to Magali.
Thank you, Nick. Hello, everyone. Magali Rojas, and I work as an enrollment specialist with a health navigation team in Kansas City, Kansas. And I have a background in information systems, and I'm with this year's 2020 ELEP cohort.
Wonderful. Did we have anyone else? Sadaya? No? Okay. Sounds good. I see the answer is no. So question for the group, what did you hear in your group and what are the main takeaways? And you can just step in as you feel called.
I'll try to lead off. This is Mike Cleveland from Legacy Health in Portland. Our first question was about how have folks on the call have developed programs and policies to promote the benefits of nature. And I have to read these handwritten notes by a doctor, so that could be a little dicey, but I'll try and capture a couple of these things and hopefully I get people's names and affiliations right. But so Mark Smith at the San Francisco VA, they've been, it sounds like, very successful in a couple of things, both monthly outings with patients, with patients, with veterans, to get out in nature once a month. And they've also started a surfing program for veterans to help them have that contact in nature. And in fact, we heard about 3 individuals who are working with surfing programs in their in sunny climes. But that was great. Nick, and can speak to it, of course, better than I, but Nick Otis talked about at the Naval Research Hospital how they not only have a surfing program, they're gathering data about mental health outcomes, and has been successful in bringing that to fruition. We heard from Laura Bolliard from the Park Service that they are using evidence to get people out to experience nature. Let me see. We've heard from Vicki Silvas, a PA and health coach in Fort Collins, Colorado, who they have been very involved. They're creating the Walk with a Doc program, trying to engage people to go outdoors and walk with a physician and sort of a parks prescription program, and kind of working through medicine in their partnerships to further nature contact. Michelle Cobo talked about a project in Philadelphia with, I believe it was in partnership with the Philadelphia Children's Hospital, which was involving pediatricians to work with families to help them, help their kids get outside more and participate in outdoor activities, which sounded very, very innovative. I believe I hope I get this right, Natalie Small talked about in mental health access, again, a surfing therapy program where they work with local surf schools in Southern California who have a little different take on surfing than surf therapy, if you will, but helping to educate them about sort of the difference between surfing just for recreation and for therapy. Peter Bonzal from the health talked about the Healthy Parks, Healthy People program they have, plus river trails assistance that they do to get people out on trails and to advocate for trails. And I'm sure I'll find a couple of others that I have left out, but it was really impressive to hear a variety of innovative things and to hear about people's persistence in making things happen. I'm sure I'll probably chime in a couple other things, but I know Nick Otis facilitated the question about barriers, and it was very interesting to hear the challenges that people are facing.
Yeah, so our question had to do with barriers to integrating research into programs and policies, barriers into integrating research into programs and policies. And we had A, B, C, D, E. We had 5 things, 5 like main themes that kind of emerged across people's discussion. So the first one, and this one came up immediately and was by far the most popular one, was things that had to do with staffing, capacity of these staff, and the capacity to do sort of a monitoring and evaluation within their regular work duties, having it be what is called in the military as collateral duty, something that's beyond what your work duties normally are. So that was the number one thing, was staffing for evaluation, resources, the time and the staffing for this. And a couple of interesting kind of like solutions that came up or whatnot were partnering with outside or local groups as a force multiplier, whether it was to implement these programs, or maybe with a local university, if it so happens that you're near one, to conduct the research with you. So number one was staffing. The second thing was buy-in from higher ups, or the fact that nature as medicine kind of needs to be more on the radar. But just this institutional buy-in was definitely the second most popular theme. And then third, of course, was funding, whether that was for the research, whether it's for a position to have someone implement the program, or to have funding for a position to have someone conduct the research. And then the last two things which were mentioned were kind of like a logistics type of like a miscellaneous but very important group that had to do with transportation, permits, maybe in the local community to do something, and then the safety of spaces, whether that's physically or socially with a racial dynamic and things like that. And then the last thing was accessibility of research for institutions or nonprofits or programs or what have you, to access this research, which is often behind a paywall or not written kind of in layman terms. So those are my 5 things.
And this is mine. And if I could add one other thing, Laura Bolliard also shared with, as working with the State Department of Forestry in Arizona, partnering with a nonprofit, that they put together a program for group walks that were successful because they were done on a regular basis and they were led by each time. And my understanding that this was with low-income minority families and people, and what they found after time was, and they're looking to get insurance coverage for this type of activity as a health promoting activity. And what I found really great was that after a while, people would even take buses to get to the site where there was going to be a walk. But after a while, after people in the group got to know each other more, they started carpooling. They got to know each other. So this program, all the physical benefits, but also was building social interaction and social capital. So that was really fantastic.
In my group, the question was, how do you envision using data that shows differential nature benefits for various populations? And just like Nick's group, we ended up talking a lot about barriers. So there were barriers at sort of the interpersonal level with participants of the surf group that Natalie leads, having mental barriers about needing to know how to swim and strength mentally and physically. So she had a great suggestion of starting slow and building relationships. She worked with populations like Syrian refugees and immigrant communities, homeless populations, and they first went and met those populations wherever they lived and talked to them about surfing. And then the first 2 sessions, they didn't even get on a surfboard. So sort of building that trust and partnership. And then other individuals in my group talked about how a lot of practitioners or medical students are not trained to talk about nature or think about nature. So having that sort of institutional incorporation in the education, and then trying to target populations where they are. So going to doctors' offices or churches or schools, wherever people go, to make sure that the outdoors is something that's it's overcoming the barrier of social acceptability. So making sure to advocate for nature where people go. And then others talked about policymaker barriers. So trying to push psychological ecosystem services or talking about the benefits to the healthcare system or incarceration system, any other very costly things to society, and how nature can combat those costs. And then I think the last thing was just about just the, again, like Dr. Fitzpatrick said in the opening statements, the intentionality of how you reach out and being authentic and overcoming barriers that way.
I can go next. So the questions we had was, what's the biggest mental health challenge or barrier faced by your community that could be addressed by better access to nature? And what are some potential ways to address or lessen those barriers? So as you can hear, it's a mouthful of a question. And so it is a little bit tough to like think about right on the spot, especially when you see so many barriers and not just thinking of the biggest one. So for the first group, Austin shares how he works with a group of veterans, and he encounters both physical and mental barriers. He's aware that there's a diverse approach needed to work with people, especially some facing PTSDs and others with disabilities. One of the barriers where he lives is the heat. And so weather was also a barrier, like either it's heat or either snow or tornado, anything really. And so getting people outside is one of them. And let's see, David, he owns his own company in landscape architecture, and he blends his work with forest therapy walks. And one of the biggest barriers is mental health as it deals with COVID. And then just the fear of the unknown, how many people, like he said, there was someone who spent 70 days not going outside of their house. Imagine that, I'd go crazy. Couldn't deal with that. So like also deconstructing, you know, the fears that we have and sharing those stories in a way that other people can understand, because we shouldn't like belittle people in the way that we explain things, because sometimes those fears are real. And then Bree, she shared how she is an HR consultant, and it's been doing so for 15 years. And a core component is creating healthier places for her workers, being outside in the corporate world, which is so hard because they're expected to always be there and to always be seen. And David, he brought up a suggestion of setting up an outdoor workspace with monitors and high-speed connection, but you know, sometimes that takes resources that we don't have. And let's see, also probably for those BIPOC people, like how do we bring them to the spaces, like creating scholarships, things that can help promote them getting there. And during this time of COVID, there is an opportunity here, so to create and encourage people to step outside without that fear of them coming in contact with someone else who may have COVID. Let's see, I think Austin made a really good ending point, which is identifying what is going to be a good fit to connect the variety of people we serve around us, because not all approaches are going to, you know, are going to be able to work for all people. And for the following group, Cynthia Wilkerson, she says, it is tough for her to answer these questions because she sees barriers all around the state of Washington. There are massively unfunded and feel like they are very far from their goal on how they can connect the community to their services. People of color have different approach to nature. Mental health can lessen the barrier, but we do not have the expertise. We have the place and the opportunity to host, but we do not have the mental health practitioners. The budget is so fragmented. And Diane says, the most relevant is the question about resources. How will we sustain it and prioritize it when we have so many aspects competing? And developing, one of her ideas was to develop a pilot that is low risk to the side of the equation as a park agency that can help with health sector. And she brought out how there's like 400 studies that have been given to promote the health benefits. We want to better serve low income. And one of the repeated questions was brought up from Wilkerson and Bree, and that is, they want to know what specific cultures and demographics need that so that they can perform with a conscious mind for those underserved populations. And let's see, just being mindful that there are basic needs not being met for those certain populations, such as lack of transportation, sometimes even clothing, time due to various jobs, not having a roof over their head, etc. And there are also fears that have to be discussed, like rangers in uniforms and how they can be frightening.
Yeah, I think those are all really important barriers to address and consider when looking at both research and how to implement that. Thank you. And Peter?
Yeah, so trying to compile all these thoughts here. I think everyone's touched on a lot of them already, so I'll try not to be too redundant. I think that the big kind of overarching themes, my question was, what evidence for the mental health benefits of nature contact has had the most impact for you? How has it affected your work or your interactions with individuals? We may have gone a little broader than that in answering some of these questions, but I think these themes have come up consistently over the other questions. But I think the three big themes were limited resources, competing priorities, and then how to effectively position nature as a in health treatment. So I think when we talked about limited resources, Cynthia from the Department of Fish and Wildlife in Washington talked about natural resources getting less than 1% of the state budget, woefully underfunded. And there's obviously with COVID seeing increased pressure and explicit value on outdoor opportunities. Mark Smith from the San Francisco VA talked about not having capacity for evaluation as a barrier. I think it was mentioned this, I forget the term for it, collateral, but basically that he's not funded to do that. So how does he do that as well? Donna, who's a nurse in New York, she measures contact hours of practitioners in nature and has to back that up with evidence. But she's looking at these nurses who some may every day in their lives interact, go running on the Hudson River, walk in a garden. But there's a big difference in kind of urban and rural settings. And so she's using the literature to support her goals, but she needs to kind of help communicate that information to these nurses across New York State. She mentioned though that there is this kind of shift nurses group that's been really helpful for her, where she can actually get access to the literature from those that community. But she thinks it'd be great if there's a clearinghouse for this literature, somewhere they could go to find all the information in a kind of neat, concise pattern. Competing priorities. So I think, again, Cynthia Wilkerson from Washington State said that there's a narrative of this kind of mental health crisis, education crisis in her state. But it'd be really great to bring together education, mental health, and access to nature, and integrate that into kind of an effective way of kind of working with these seemingly competing priorities. But maybe there's a way of communicating that message, and that like nature may help all of these things. So it's not a competing priority, but maybe it's mutually beneficial. Mark Smith from the San Francisco VA talked about kind of how to convince policymakers to make nature a priority, housing and this economic crisis, food security. Those are all huge issues in his work. And how do we have nature rise to the top? Should nature rise to the top? I think is another question, because you can't actually address all that. I brought up the point that we don't want to say, oh, we plant a tree, we feel good about ourselves. We don't need to address all of these other major societal issues. So that's something to think about. But then our group, is really thinking about evidence. And so how do we position nature as an effective treatment? Diane from the Institute of Golden Gate in San Francisco was talking about positioning national parks as health resources, doing the research and identifying opportunities for the parks and park programming to help the communities that they serve, as well as kind of reframing this programming to healthcare providers to see it as a resource. And I think that's a big step that I think as practitioners, it's hard to do alone, but as the research community can work with these practitioners to understand how to move this research forward, to make that case, right? To put dollars and cents with it in terms of healthcare costs, to understanding how parks actually give us so much. I think that's a really important thing. Diane also talked about park staff as interpreters. They interpret historical and cultural aspects of parks, but we need to have them translate the health assets of parks to the community. Laura Bolliard in Arizona's National Park Service was talking about, and I think this was already spoken about, but I'll say it again, about this really innovative approach to kind of taking Alzheimer's patients and their caretakers, and the caretakers suffer a huge burden of disease due to the stresses of caretaking. The State Department of in Arizona has looked into nature as a potential bomb, and they're doing focus groups thinking through these interventions of having people spend as caretakers and the patients spending 10 to 12 weeks of going to a park twice a week, evaluating that so that we can understand how effective it is in reducing this health burden on the caretakers. I think that'll be really, really fascinating to see. And then Kim Allen in New Mexico, who works in this area, she's getting her doctoral degree looking at kind of the nature-based treatments. And she's also a practitioner of health who prescribes, tailored prescriptions for nature-based treatments. She brought up the point that there's research that shows that even cost-effective nature-based treatment might seem less attractive to people than a costly drug-based treatment, right? So we really need to think about the psychological side and how do we, defeat that the big pharma that has gotten into our heads so much that we think, it might be our heads, it might be physicians' heads, that a drug treatment is what we go to first, as opposed to a really cost-effective nature-based treatment. So I think, all those aspects together, I think are really, really important. And that's what I got from our group.
Thank you, Peter. Yeah, and definitely, I think in terms of mental health, when talking about medication therapy and nature, I think it is one thing that practitioners definitely want to caution against, of like, smile, you'll feel better, take a walk, you'll feel better. And, historically that has been a societal attitude towards mental health. And I think it's really incredible that we have evidence that shows, taking a walk does make people feel better. Also, if we're dealing, with major depressive disorders, like taking a walk, also medication, also therapy, there are so many tools that need to be used in conjunction with one another to really address mental health. And I'm, talking more on an individual level. But, how do we elevate nature as something that's on the same level as medication and therapy? I think that's really incredible. And so our group, we spoke about what do we need in terms of research and dissemination to create a public health shift that values nature as a viable mental health intervention. And so Austin was talking about there's this sort of science practice gap of 17 years that it takes for having the research to like putting it into practice. And then when things are put into practice, sometimes it's implemented poorly or not in the way in which it was originally intended. Sort of further creating this lag in what people know and like what people actually do. And so Dave, who is also living in Minneapolis, I absolutely love that, was talking about, how we had focused sort of on the corporate level of things, of how do we tap into corporations to convince them that keeping employees healthy is way more advantageous to them than going through the process of like rehiring and retraining someone. And in this vision of keeping people healthy, how, like nature can do that. So how do we build sort of advocacy within larger groups? And then talking about, how do we bridge this like 17-year science practice gap? Dave was also talking about, few corporations have like a solid research department whose sole job is to look at what is coming out from this field right now that could be implemented immediately into practice. And so, how do we keep the conversations going between research and practice to sort of speed up that 17-year lag? And I'm excited for the conversations tomorrow because I think that'll definitely talk about practice, and this is a really strong foundation to build that conversation going forward. And then Bree was talking about, friendly competition doesn't hurt in terms of, if you're hiring at two different companies, it is very socially acceptable to negotiate salary and to negotiate benefits. And when you have people asking, like, what are your nature benefits? What does that look like? You can leverage that and encourage, potential employers to think really critically about what they are offering to their workplace. And then the idea that was raised was to, we've spoken today about a lot of really critical information that is sort of coming to the forefront of conversation. Is there a way that we could create like a centralized Google document or area that has all of these individual studies? And Nick, I was working, my good colleague Nick was working with him for a presentation last night for the Emerging Leaders Program. And he had the good idea of starting a Google folder to put in PDFs so that, people aren't coming up against this academic paywall that further keeps people away from really knowing what's going on in the field. So those are sort of our big conversation topics in our group. And I have another question for the panel, unless do people have responses to this that they would like to talk about? No? Okay. So my question is, have people found partnerships in this group that will influence their work going forward? Were you able to connect with anyone being like, wow, we're doing the same thing, or, your work supports mine. How can we uplift one another?
There's some people, seems like within a 10-mile radius of me in San Diego that I've chatted with a little bit, and yeah, I think we're gonna keep talking.
I was very encouraged to hear just about the various programs and efforts that people have been made. And I do want to get everybody's email and maybe reach out about collaboration, because I think there's plenty of opportunities to do that. Teresa Hazen and I are looking to, work on projects, speak and so forth about these issues. And it's just very encouraging to hear what's going on. And so I'm going to want to follow about those surfing programs, not for me personally, but for the surfing programs and the VA Warrior program, get veterans out there in nature, and just a wide variety of great programs. So I was very appreciative to hear about the programs and the partnerships and the effort that it's taken to make those happen.
Yeah, and I'll say in my group, I think we had some great talk between Laura in Arizona and Mark at the San Francisco VA, thinking about this idea of caretakers, and I guess the VA has this healthcare support programming. So I think Mark's looking forward to seeing what Laura finds in this program on caretakers of Alzheimer's patients. I'll also say that just hearing from Kim Allen, and she forwarded me that article that talked about the cost effectiveness of a nature treatment versus an expensive drug treatment. I really look forward to learning more about that and thinking through the psychology of why we have that barrier. Yeah, for me that was really eye-opening.
I think as a researcher, hearing how each person overcame the barriers to connecting whoever they were trying to connect to nature was really helpful, and seeing what they needed from the research to get to the results that they're looking for was helpful to know as a researcher.
Yeah, I think for me, I connected with Vicky Silvas, who's a PA involved in this work. And I think as a medical student approaching this field, I haven't had any, programming given by my institution or any lunch lectures or anything on nature and, how we can implement that into practice. And so we were talking about maybe coming up with a panel or a course that could bring more students into the mix and get people started on this early. And then I think through this whole thing, I've really just enjoyed getting to know everyone and seeing the work that's getting done. It's very heartening to see it being addressed from all different disciplines. And then another question I have for everyone, unless people have more to contribute, just cut me off if you do. I'm interested in knowing how disparities were addressed, because that was a big part of our conversation with Dr. Fitzpatrick this morning. And I think, especially when it comes to research, there can be this gap in between who is doing research and who is affected by the research that's done. And so I just want to open that conversation to, what do disparities look like in terms of research practice and what came up during our small groups?
I think it was helpful to hear from a researcher in the Forest Service about how they implemented a program and then it had disparate outcomes for women versus men, and how they're going to address that. Because I think as we go to move away from just using nature as adjunctive care and doing more intervention studies, it'll be important to address things that we as researchers had no idea that they would occur, and to try to maybe even do qualitative studies to try to address the mechanisms behind why differences occurred and how to address those with the opinions of the community in mind.
I don't know if this is something that necessarily was in fact, it wasn't brought up in the conversations that I had today, but I think that overwhelmingly research can be extractive, overwhelmingly to communities of that are disadvantaged or vulnerable or targeted. And I think that's a very, very, very important point to keep in mind when doing any community-based research. I'll just add that comment because I think it's very important.
Thank you.
It was very helpful, if disturbing is the right word, but to hear about, again, Michelle Cobo, I believe is the right name, who described this program in Philadelphia of trying to get children and their parents out, being more active. And again, this is underserved population. And just that the number one, sort of know this, but just to hear it from her practically and being a huge barrier for the program was just safety. I mean, basic safety. At Legacy, our CEO has put on the idea that we want to be the safest, the safest healthcare system, and it's physical safety, psychological safety, and professional safety. And if parents in a neighborhood and a community are fearful, rightfully fearful, just about even physical safety, gee, no, I don't let my kids go outside and play, and I'm not going to start. It was good, but painful to hear that, and clearly a huge barrier and issue that as we move forward to try and close disparities, increase access, nature, and therefore over time help hopefully close health disparities. We really have to look at that fundamental safety issue.
Yeah, absolutely. And I think what Peter was talking about earlier in terms of, we're seeing the disparities in which spaces become greener and which spaces remain the same. We're seeing that increase, correct?
Yes.
And that's really hard to hear and hard to see. And I wonder what it would take to, get them both up to the same level of green space. Did you talk about that at all?
In my group? No, unfortunately we did not address this. I would have chimed in. We really, maybe we took our question a little too literally, but no, we did not look broader, but we, certainly it's something we think about all the time. I think I spoke about this during the panel, how to do that effectively. And I don't know if, Michelle Kondo, if you wanted to speak about your work in Philadelphia, but I mean, I know that there's some amazing work out there. Michelle's done like randomized trials, and there's so many fascinating studies that have been done even on the kind of probability of gun assaults. I think, Michelle, you've done some work in that and in relation to green space, but maybe you could speak a little to that. Sorry to put you on the spot here, but.
Well, I'm going to talk about it on Friday.
Okay, so never mind.
Yeah, and the whole theme is safety. So it's a little plug and an ad for everyone to stay tuned. Yeah, it's a huge issue. Thanks, though.
A great point that was brought up was just simply asking people what they need versus telling them. And with that, taking a holistic approach, just because there's, like we've said so many times, basic needs that need to be met before telling people this is why nature is so important.
Yeah, I mean, I think I don't know if our group specifically spoke to that, perhaps the work in Golden Gate Park, but thinking about the needs of a community and actually bringing in the community as opposed to saying, here are what the needs are based on, some data set. It really is, it makes it hard, I think, from a practitioner's perspective to say, well, we can't just implement some programming. We have to actually talk to the community, but I think it's really essential to understand what a community actually wants, as opposed to this kind of top-down approach.
Yeah, I think, Magali, like what meeting basic needs is so crucial in that. And I think Peter too, talking about safety and what does safety look like. And I think safety looks physical. I think it looks mental. I think it looks emotional. And I think that those are all needs that, have to be met day to day. And I think also especially have to be met in outdoor nature spaces, especially if they are, I guess, both urban and rural spaces. And that a lot of what people bring to the table is their own history,
Exactly.
both uplifting and both really hard, and sort of creating space to honor those experiences and really ask what people need. I think at the heart of this really is authentic relationship, and yes, we can be studying people as subjects, but also at the end of the day, really establishing that trust and letting people who know the local community lead, and take initiative in those things and speak to what is necessary is sort of the cornerstone of really all of this.
I think also the importance of creating long-term, meaningful partnerships that will last. You know, one of the biggest barriers in my community is the barrier of language. And if you don't know how to speak English, how are you supposed to navigate?
Yeah, absolutely. In terms of signs and everything too, I think, you know, disability accessibility is huge. Um, in terms of, are there paved paths that go through spaces that feel like they're out of, you know, like just by the nature center? Are there sort of the raised pavement at the end of blocks for people who are vision impaired? You know, how do we make, you know, this difference between like, hey, you're invited to the party versus I would love to go with you. And, you know, accompaniment in the sense of walking with people through their lived experiences, asking them what they need, and then really taking that into account, especially when there is a power differential, as there tends to be in the field of academia. So we have about 5 more minutes of discussion time. Do you guys have any questions that have yet to be answered or discussed? Creating space for silence feels very different on Zoom. I can definitely tell you that. I think one thing that really jumped out at me was Dr. Cleveland's story he told in the beginning of, you know, this moment of reconciliation in a garden. And I think one thing that definitely was brought up in our group was, you know, research is necessary, as well as integrating a narrative to that. And I think those are two very complementary pieces that work together to draw others in and bring them to the table. You know, we are human, we are relational, we want to hear those personal stories, and we also want the data backing that up.
You know, thinking about how participating this great call today has, though it is a bit odd that silence is not, but the in terms of moving forward, I'm just very encouraged. I'm encouraged to hear about the various projects and research a number of people, not just people on the panel, but people throughout are doing. That's very encouraging to me. And even though there are barriers and sometimes programs have not worked out or this option has not worked out, I can feel the persistence that people have in pursuing this such important work. And I know both in terms of advocating in the political realm and stuff I've found over time, and just getting things done at work, is that persistence is just a great, is an important and great virtue. And then just finally, you know, we're having a transition at Legacy because our longtime coordinator, Teresa Hazen, is retiring, though she's going to volunteer with us a little bit in employee health so we can still work together on some events. And we have a great replacement, Megan McKiernan, who's coming on, so we're going to have continuity and keep flowing along. Yes, yesterday I was actually in Southern California, where it was nice and warm, and not so much now in Portland. Had a few days break, and on my drive back to LAX to fly home, a song that most of you, because of your age, probably don't know, but Steve Winwood, who's a great musician, has a great song called The Finer Things. And one of the great, I was thinking about the call and what to say and all this kind of things. And one of the lines is, the finer things keep shining through. I'll spare you singing, and that would be bad, but the line is great. And I really feel that your work is shining through and will continue to shine through. So thanks for all of that, and just continue to be safe.
I think it's really inspiring where our field of research is headed, whether it's through operationalizing terms of green space or even safety, or things that have not been standardized in the research and have contributed to barriers in developing active interventions, but also listening to the community and hearing about not traditionally studied constraints like trauma or stigmas. I'm really inspired to keep conducting this research and working with practitioners and policymakers to make sure that the end goal, the applied goal, is met.
And maybe I'll put in a quick plug before we end. I mean, it's been, as everyone said, really inspiring to hear about everyone's work. As a researcher, I want to, put myself out there to say, if there's something you need, or if there's something that I can do to help provide you more evidence or analyze data, you name it. We certainly are here, and what we want to do is have our research be used, have it be useful, not just sit on a shelf. So I feel like there's some things where we've been lacking in the past, and I think we're trying to do better work. So please feel free to reach out to us, because we want to provide you with the data you need to do more effective work.
Thank you, Peter. I will definitely keep that in mind going forward. I think it's really incredible to witness everyone bringing their strengths to the table, and being willing to offer that to others in service of this greater cause of promoting nature as a tool. And that's just been a joy to learn from everyone today. With that, I will conclude. So thank you for joining us in today's discussion of the benefits and barriers to nature as a mental tool during this convergence of critical events. We've heard a lot from people all across the country and globe of the work they're doing to move this public health imperative forward. So we hope the panel and breakout groups have provided fruitful conversation regarding nature as a public health intervention, as well as provided a setting to establish partnerships. We look forward to advocating for and implementing this work together. Please join us tomorrow to discuss what this research looks like in practice. Thank you all.